Welcome, everyone. We start the meeting with the Pledge of Allegiance, so please join. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, looks like a short agenda this morning. First item is always public comment. I just peeked Christie, there's nobody signed up. Would anyone like to sign up? For example, our city administrator from Staten who doesn't want to speak publicly. Welcome, Keith. Okay, then we'll move right to the consent calendar. Commissioner Carlson, I believe.
Well, Mr. Chair, there's an item on the consent calendar that I think we want to make a motion to carry over till next week. Is that correct? So that would be the item under Public Works. Approve amendment number 7 to the contract for services with Pacific Sanitation, Inc. to increase the rates for waste energy facility at Coffin Butte and Woodburn Disposal and extend through September 20th, 2019. So I'll make that motion.
So the motion is just to hold it over and then put it on an action.
to carry it over to act. Yeah, that's fine, to action next week.
Okay, I'll second that
All right, it's
motion.
moved and seconded to take the item under consent, Public Works Amendment to contract services with Pacific Sanitation, hold it over next week as an action item, get a little more information on it. Any further discussion? Hearing none, all in favor say aye.
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 All right, thank you, Mr. Chair. And with that, I would move today's consent calendar minus the item that we just carried over. So under Health, approve the contract for services with Locum Tenens for $255,000 to provide national health care temporary staffing services. Approve an order appointing Brian Butler to the Ambulance Service Advisory Committee with a term ending December 31st, 2020. Under Public Works, approve amendment number 2 to the Public Improvement Agreement with K&E Excavating, Inc. to add $38,004.87 for soil stabilization and mandatory price adjustment for asphalt concrete pavement. And under Tax Office, approve an order advancing tax levies to small taxing districts pursuant to ORS 311.392.
I'll second the motion.
All right, it's moved and seconded to approve the consent calendar this morning. Any further discussion? I don't hear or see any. All in favor then say aye.
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 Aye. That motion passes. Thank you. We have one item under, one action item, I should say, under Health. We consider approval of amendment number 3 to the intergovernmental agreement with the Oregon Department of Human Services to add $17,016,486 for community development disability services and extend through June 30th, 2019. Carrie Mueller and Carissa Neufelder here. Might take a little time because although we've had work sessions, I don't get it. I don't know what's going on. So I hope, Carrie, that you can explain it.
Good morning, Commissioners. Thank you for having us. I'm Carrie Mulder, Health Department Administrator, and with me this morning,
Carissa Neufeld, Program Manager for the Developmental Disability Program.
So yes, we are seeking your approval for our intergovernmental agreement with Marion County and the Department of Human Services, which funds our Intellectual and Developmental Disabilities Program. So I am here this morning to take the opportunity to sort of talk about the system overall and what's happening currently within our funding structure and some changes that the Marion County Intellectual and Developmental Disabilities Program has experienced. That really is a mouthful. Two things really. The Oregon Developmental Disability Program at the state level was mandated by the legislature this year to create some sustainability within the funding of the Intellectual and Developmental Disabilities Program. So the IGA that we are seeking approval today is a bit unusual, actually. What they did this time is they actually extended the 15-17 IGA through September 30th of this year, so into the next biennium. And during that time for the extension, they changed substantially the terms and conditions within the IGA. It was actually a complete rewrite. At the state level, with support from our legal counsels and with the administrators across the state, we looked at those terms and conditions, and as a collective agreed that we could generally meet those expectations. So what you have before you today is a request to amend the 15-17 agreement to include those new terms and conditions and add about $2.5 million to our overall contract here in Marion County. What makes that a little complicated is we continue to see more individuals who are eligible for services here. So there was an increase in the overall anticipated number of people that we're serving, which increased our overall funding. And at the same time, we eliminated the Mid-Valley Region Crisis Services that historically had been a developmental disabilities crisis service. We had 5 of those regions in the state. Marion County hosted one of those programs. You've heard me talk many times here before about the K-Plan over the last few years. The K-Plan, otherwise known as Community First Choice Option. What the K-Plan did is it allowed children, for the first time in Oregon, to access in-home services and supports without being in crisis. So previously, children had very little and quite limited access to services unless they were in crisis. So with K-Plan, it allowed kids and families to now be seen, and it reduced the need for our crisis response service known as the region. So finally, this legislative session, the regions across the state were eliminated. So amongst several things, I just wanted to highlight 2 things that the state, the Oregon Developmental Disability Services, was tasked with through the legislature. They reduced our state general fund by $12 million in each year of this next biennium, so a total of $24 million. And as I just said, they eliminated the regions. Part of the strategy around the $12 million reduction was to implement a new assessment tool, which Carissa talked with you about earlier this week, to eliminate an assessment tool and took some other actions to curb the overall spending. So the state has been instructed to come back to the legislature and report how effective that action is in terms of reducing the overall spending. The annual increase in costs in our state developmental disability services because of the open door that K-Plan created, the legislature says is unsustainable. So if these early changes don't achieve the kind of sustainability that's intended, the state will consider moving forward with eligibility changes, and again, as I said, are tasked with reporting back to the legislature on how these services are, how these changes are affecting the sustainability. So that's sort of the state level overview. We're doing some really fabulous things in our developmental disabilities program, even in the context of these really sort of difficult changes. So we've got many systems changes that have been happening over the years, and we've been seeing an increase in our enrollments. The state anticipates that will level out some, but I did want to take the opportunity, besides talking about those things, for Carissa to say a little bit about the program, give you an overview. And I think before you have a handout that she's created, so that will give you some context for the discussion. Any questions before?
Can I just add a comment before we move on to that? Is that all right, Mr. Chair?
Sure.
So I appreciate how you say creating sustainability, but in my mind, that's kind of code for the idea that, well, let me just back up. The way that I tell the story, I was just telling the story to my husband in the kitchen the other night, and so the deal is that in addition to the K-Plan, which is part of the Affordable Care Act, right? So that is a Medicaid option, it says. I was just looking it up that we have. And so with Medicaid, there's a state match that's required. Is that correct? It's not 100%
That's correct.
Medicaid. And so the state has to pitch in some money in order to get the federal money. But the other part that was going on kind of at the same time that overlaid it, and we talked about that at the work session the other day, is the idea that we were on a caseload model for developmental disabilities and went to a workload model, right?
That's
And
correct.
so from what I understood, senior services had gone through the same analysis, mental health had gone through the same analysis, and developmental disabilities was kind of the last in the queue to go through the analysis. And what happened when you layered both the workload model and the K plan on top is that a whole lot of people underneath the new structure would be eligible for services, either more intensive services. I remember Tricia Baxter talking when she came over, talking about when they did the analysis of it, that because people were worried that services would get cut, that they thought actually when they did this workload model, there would be more people getting more sets of services under that model than under the caseload model. So then when that went to the legislature, then it was like, oh my gosh, this is going to cost us a whole lot more money. So you need to create sustainability, and that's code for you need to make it so we don't have to put as much money in. Well, all that means is that either fewer people are going to be in it, or the people who are in it are going to get less service, right? I mean, that's the only way you can create sustainability. So I think that's the concern. And then you overlay that with the proposal that's on the table about lowering the eligibility for people, for families, so that they have to be in poverty in order to access services. And so there's a whole lot going on that I think is going to be pretty disruptive for certain families that have either come to rely on services, or are we going to go back to what we did the Staley settlement for, which is long waiting lists of people that are supposed to be getting service and in their entire lifetime never see any service. So I'm just going to throw that out because I appreciate you being very politically correct and trying to put a spin on this about how we're doing some great things, and this is definitely not Marion County's authority to fix. It is a state level decision to make, and the Ways and Means Committee, I appreciate, has some really difficult decisions to make, but it feels like the decisions, the dollars are going into other parts of the healthcare system, and that this part of the healthcare system, disabilities services, is not receiving what they need in order to move forward. So that's my own personal opinion.
Thank you,
Just put that
Commissioner.
out there.
It's a really complex issue. I will just say Oregon does have, right now, the most generous eligibility criteria of any state. So, and the advocates, the people who care about people who have intellectual and developmental disabilities are passionate about these changes. So we were a long way to sort of some final decisions here, I think. The state, in their efforts to respond to the mandate from the legislature, took some steps, and they actually were sued. So they had to roll that back a bit, and we got to this new assessment tool sort of as a result of sort of that class action lawsuit. So again, it's a very active advocacy group,
So kind of stay tuned. Right?
Stay tuned.
Right.
That was my last.
Okay.
That was my last sentence here.
Okay,
Stay
all
tuned.
right.
But in the meantime, let's hear from Chris.
Okay, thank you.
Yeah.
Good morning, Commissioners. So with the amendment on the table, we thought this would be a great opportunity to provide you with just a brief overview of what services the Developmental Disability Program provides, and talk a little bit about some of the program successes, challenges, and goals that we have over this next biennium. So hopefully you have the handout that we were able to provide for you. The Developmental Disability Program provides really 4 core services. We are the front door for eligibility at the local level for eligibility. So that means that any person who believes that they experience intellectual or developmental disability needs to come through the local Developmental Disability Program, in which case is Marion County. The individuals eligible for services are people who experience an intellectual disability, which means somebody who has an IQ under 70 generally, or a developmental disability, which means somebody has another diagnosis of a disability such as autism, Down syndrome, maybe a chromosomal disorder of sort. Generally speaking, these are disabilities that are evidenced in childhood, either prior to the age of 18 for intellectual disability or prior to the age of 22 for other developmental disabilities. You'll see in your handout that there are 2,600 or so individuals that Marion County has determined eligible for services. So that doesn't necessarily mean that is the number that has applied. Far more actually apply, but those are the individuals that have been determined eligible. The other primary and our biggest service that we provide is case management. So again, in your handout, you'll see that we are providing case management services to just under 2,100 individuals. And you may be wondering why there's a difference between those eligible and those receiving case management. It's because here in Marion County, we have 3 other case management entities known as the support services brokerages that also are able to provide case management to adults 18 years or older. So they are actually providing case management to that difference of 500 or so individuals. Of the individuals that we are serving, we have about 857 children and 1,241 adults that are currently, as of yesterday, receiving case management services. Our caseload growth over the last biennium has been about 7 to 8%. This is consistent with the overall statewide growth as well. Of the new applicants that we receive each month, I would say we receive anywhere from 15 to 25 new applicants per month. Of those applicants, 40% are adults and 60% are children. And we believe that influx of applicants from the children is a direct result of the K plan that Carrie talked about. For our case management, we're unique in the fact that we provide a lifespan case management service, meaning as long as somebody continues to demonstrate an intellectual or developmental disability, we technically could provide case management from cradle to grave, which is very different than any other, I think, human service that we have. We provide under the umbrella of case management, information referral, advocacy, home and community-based services, which I'll talk a little bit more about, and service monitoring. Additionally, we are charged with providing adult abuse investigations. So when we have individuals who are experiencing intellectual and developmental disabilities and we believe that they are also experiencing potential neglect and abuse in our community, then we are charged with doing those investigations and providing protective services for those individuals. We also provide foster care licensing and certification. So we don't actually issue the license and the certification, the state does through DHS. However, we are the legwork that gets all that done. So we are out working with the foster care providers, doing the home studies, et cetera, to provide the screening process for the providers. Within the actual home and community-based services, Carrie referred to them as the K plan, but I'm going to break it down a little bit more into lay terms. For children, we're providing family support services, which would allow a family to be able to help meet their child's needs in the family home. This may include being able to pay for special adaptive equipment, modifications, needing, their child doesn't have verbal capacity, so they use some sort of a adaptive machine or computer to communicate. It could mean a modified wheelchair for their child. Those are some examples of family support. For individuals with more extensive support needs, we also may be able to provide in-home supports, which may mean having a personal support worker coming into the home to help provide support in addition to the family, because some children may need more support than just what the parent is able to provide. We also have residential services, which are often referred to as 24-hour care or group homes in our community, and those services are provided by provider agencies such as Partnerships in Community Living, Shangri-La are some examples. We have adult foster care homes and children foster care homes for those families who believe that their children or their adult children need to have a higher level of care and need to be supported outside of the family home. And then we have employment services and transportation services. So I think you probably have heard over the years, last few biennium, about Employment First. And we are working hard to be able to provide community-based employment services for individuals. I think that moving into program successes, I just came on board here in Marion County about 3 months ago, but it's really clear that the County Developmental Disability Program has been doing a lot to continue to try to improve services here. I think one of the biggest things that has happened is we're really trying to strengthen the leadership and personnel within the Developmental Disability Program. So we've added my position, which I understand is a new position to the Developmental Disability Program. We've added a couple of clinical supervisors, which has allowed us to strengthen the support for our case management team and divide our case management into kids, a transition age, and an adult team. And we've added a quality assurance coordinator, as we know that it's ever more important for us to be able to better assess our performance and make sure that we are in compliance with the state rules and regulations. We're improving our collaborations. We know that we need to do a better job in communicating with education, with mental health, with the juvenile services, and many other community partners as we continue to try to struggle with resources and how we best meet our family and individual needs. This has to be a group effort, a collaborative effort. We are continuing to support community-based employment. We have, with the K plan, even though there are challenges and there are risks for sustainability, it has provided individuals a lot more flexibility in being able to move across services rather than having to declare yourself in crisis and being at risk of institutionalization. Somebody who's eligible for services can say, I want my services in the home or I want my services in the community. And that's a really great thing for our county to be able to say to a family, yes, we understand your need and we're able to meet you at the point that you want. And then, as we said, we're streamlining assessments, and I know this is a very big change, will be for individuals and families, but in the long run, we really are excited about the idea of our staff not having to do multiple assessments, as well as, and most importantly, for our families and the individuals we serve to only have to experience one assessment. Our program challenges, as Carrie mentioned, of course, are budget related, but we also have increasing pressure from the state, and you'll see that in the IGA amendment. We have performance measures that they have added, and this is a result of the state moving more towards a performance-based contract. So we've always had an expectation that we provide good services and meet the compliance of administrative rules and whatnot, but having it in the IGA certainly makes that more clear. I think our other really big challenge here in the county is, and this is not a new issue, but is qualified providers and qualified staff. We have, unfortunately, a bit of a high turnover here at the Developmental Disability Program with staff, and I think in part that's a bit due to the workload and all of the changes in the system. That has caused staff to sometimes want to run away to other jobs. But we also are facing a rural workforce crisis with our provider organizations. We have, I think, about 3,000 personal support workers here in Marion County alone, and the pay is not very great. So the quality of worker that you get for $13 an hour is not always the best. And so we have a hard time being able to find qualified and sustainable workers that are willing to stay for a long time. Additionally, we have an increasingly more complex population that we're serving. The individuals that we are serving are coming with a lot of co-occurring diagnoses, mental health, criminal backgrounds, et cetera, and it's just becoming more and more challenging to find providers that are able to meet our complex needs. We have, aside from the service things, we have modernization needs. As the state continues to modernize their systems, we're constantly trying to also modernize our systems and be able to think more smartly about things, think more innovatively, and how do we collect this information in such a way that, that we can provide you access and easy information as well on our performance. And finally, biennium goals, I think we're looking at, of course, trying to get fully staffed. We have a number of vacancies within the agency or within our program. We're going to be rolling out the single Oregon Needs Assessment tool, working on modernizing and improving our data collection systems, having a more focus on provider service capacity, both on the employment side in particular, as we are in our last year of needing to move individuals from more sheltered workshop settings to community-based employment. And of course, continuing to strengthen our community partnerships and make sure our community is aware of the service needs and supports for the individuals and families that we serve.
Well, here's my impression. I still don't understand it all, but I'm confident that you do, so that's helpful. But I just got to make a comment. You hint at higher administrative costs all through, and I'm looking. I just want to make note of these 11 exhibits in this agreement, and without looking at them, special terms and conditions, general terms, standard terms. It's whatever they want it to be. So doesn't that imply higher administrative costs? And that's maybe what you were referring to, Carissa, which means less money available to people that need it.
Thank you, Commissioner. We are still really diving into the implications of the changes with the terms and conditions. I absolutely think that there will be, and there is, administrative impact to us. There's a statewide work group right now looking at rates and the services that sit inside of the administrative funding stream within the IGA. So your points are very well taken, and as with my ending remarks, there's a lot for us to still dive into, and I think a lot more to come on these things. It's a very active conversation right now, and the state director is engaging with the community to try to I think everybody recognizes that these changes over the last few years have been massive, and Carissa alluded to the impact it's having on our workforce, the impact it's having on our management structure, and the impact it's having on the state. So to move from general terms and conditions to a performance-based contract, that's huge. And people did have some concerns about, with all of the pressures on the system, how possibly can we get reorganized and structured in order to meet those expectations. So.
Questions or comments?
I had one question about when you mentioned the employment component. The sheltered workshop issue, that's another one that overlaid it in terms of what agreement was that? That was I can't remember the name.
Lane versus Brown settlement agreement over this issue.
It's another settlement agreement. So where are we at with that? Because I know there was some transition money that was given to Garton and some instructions that there were some deadlines in terms of not taking any new people and getting people in the community. So is that moving forward, or how are we doing with that?
We are continuing to work with our employment providers. We, here in Marion County, we have the pleasure of having two of the largest remaining facility-based employment settings. And so one of our biggest challenges, frankly, is that capacity for other employment providers to be able to serve and support those individuals in the community. We also, the deadline is, according to the state, is September 2018. So we're about 11 months away, where the state will stop funding those facility-based employment providers if they continue to provide supports in a facility. So it doesn't mean that they're shutting them down. It just means they're going to quit funding them. So obviously we are not interested in having people sit on the couch. We want to do what we can. So the state actually has approached me about doing an RFP to solicit more employment providers to Marion County to be able to meet that service need. So we continue to have our service coordinators communicate with the individuals around the importance and the value and opportunities to work in the community. This last group, so to speak, is, as you can imagine, are individuals who may have spent a very long time working in these facilities. This is what they're familiar with. And so encouraging them or helping them understand those other opportunities, it's a little bit more challenging.
Figured it would be. Thank you.
Oh, it's just a dirty deal. I can't say it any different. I have a young relative and has been working at Garden, loves it to death, meets people active. That's what he looks forward to every day, and then to tell him never more, go find something else, and it means nothing. They try to find a job for a few at the expense of many. I'm sorry you brought it up again. There's some things
Well,
that touch me off.
It's part of the issues.
Rod.
I was just going to make a motion, but now you got me to you got me to make a comment. And Carissa, thank you for your service and being on board. We really appreciate having you and educating us. And the work session or whatever was a work session we had or management update. I can't. They all blur to me, but I just remember you talking about the new tools that are going to be implemented. But you made a comment, and again, I'm going to follow up on Commissioner Carlson's. You're being so tactful in your presentation today, and as somebody who's spent some time in the building and understands really what's going on here, or think I do, you mentioned cutting the funding, but they weren't going to shut them down. I don't see the difference.
Right, exactly.
And you know, they can say all they want about cutting funding and not shutting things down, but when you take the money away to operate those things, I don't know how you figure they're going to continue to go. So, Mr. Chair, we have some very tactful presenters today. I really appreciate what you're doing with what you have. And if you're ready, I'll move
Sure.
make a motion.
Fine.
Mr. Chair, I'll move that we approve amendment number 3 to the intergovernmental agreement with the Oregon Department of Human Services to add $17,016,486 for community development disability services and extend through June 30th, 2019.
I'll second the motion.
All right, it's been moved and seconded to approve the amendment number 3 with the intergovernmental agreement with Department of Human Services. Any further discussion?
Just, yeah, maybe just a clarification, because Carrie, in your remarks, you mentioned we were going to add 2 million, and this says 17 million. So this 2 million above where we were is the full 17 million.
That's correct.
Okay, thank you.
And if I could just add, I mean, we're going to have some discussions, obviously, in the upcoming legislative sessions. And if Association of Oregon Counties can be helpful, or if commissioners can be helpful, please call on us to be advocates for you, because obviously we're dealing with a whole lot of complexity here and big decisions coming up.
All right, I've said enough. Anything else? And all in favor, say aye.
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 Can I
Motion
just
passes.
finish by saying how much I appreciate your support? And these are difficult conversations, but the engagement with our programs and around these issues are so meaningful to us. And the fact that you're paying attention and offering this support is very much appreciated.
Thank you.
Thank you. All right, that's the only action item, no public hearing this morning, so the last thing to do is read the places we'll be together in the coming week. Today, Wednesday the 18th at 11:30, we have a Catholic Community Services Annual Luncheon at the Salem Convention Center, 200 Commercial Street, Southeast in Salem. Tomorrow morning, Thursday, 8 o'clock to 9, City of Salem, Marion County, meeting at the Sassy Onion, 1244 State Street, Salem. And then another luncheon on Thursday, 11:30 to 1, the Family Building Blocks Dream Builder luncheon, also at the Salem Convention Center. Next Monday, calendar review, 8:30, Silverton Conference Room, 555 Court Street Northeast in Salem, the 5th floor. That's followed immediately by management update in the same location, the Silverton Conference Room. And then following that, Board of Commissioners Chief Administrative Officer meeting immediately following management update. Executive session is needed pursuant to ORS 1926602 A, B, D, F, H, and I. Silverton Conference Room. Tuesday, the 24th, 8:30 to 10, Community Corrections Board in the Silverton Conference Room. And next Wednesday, the 25th of October, our board session here in the Senator Hearing Room. All right, so that's all on our agenda. Keith, you still don't want to talk to us? All right, anything else anybody else would like to say?
Well, yeah, I'd just like to comment that board office, and particularly Jolene and myself and Ashley Marshall have been working with a group of students from the Atkinson Graduate School of Management over at Willamette University. They're called the PACE team, and they're helping us assess our communications as a Marion County organization, both internal and external. We have a survey that's going to be going out this morning to employees to find out just what they think about us in terms of how well we communicate and how they're receiving information, and whether they have some ideas about how we could do better in that. So I just wanted to encourage everyone who's an employee who might be listening, and we're going to send out an all-county email. We're going to ask the department heads and elected officials to encourage their employees to participate. And Jolene is going to be sending out a kind of an employee newsletter format that describes what the PACE team is, has some pictures of them, and helps. And so there'll be different ways that they'll be getting the email. Also, there is a drawing. If people, first of all, I do want to say that that the SurveyMonkey link is going to the team at Willamette, so the folks in Marion County will never see the responses. There's no way we can tie an employee to a response. It's all going to go through Willamette University, and they're going to analyze the data, and what we'll get back is a report where it shows percentages and numbers of people that said this and that. At the end, and it's voluntary, if people want to put their email address in, that will get dumped into a separate section, and we agreed yesterday that the Willamette students would figure out a way to randomly select the email, and Ashley Marshall has been able to get us a $40 gift card to Delaney Madison Grill. So one lucky person that does the survey, there will be an incentive for everyone to do that, because there will be a drawing. So I just wanted to let you know that this is going on today, and everybody who might be listening, if they want to participate. But we'd like lots and lots and lots of employees to fill out the survey so that we can get their opinions on communications in Marion County.
I'm only smiling to myself. They interviewed me by phone when I was driving to
They
Klamath
told
Falls
me.
for ONC. But it happened to be right when I'm coming by Odell Lake, and,
You got cut off.
well,
So much for communications, right?
it was snowy. I'm not in snow mode yet. Believe me, I had my Tahoe, but still slipped a couple
Oh,
times,
man.
so I was happy not to be talking anymore. But that's my excuse. If they don't like my answers, they probably didn't get it completely. Wouldn't you think that'd work?
Oh, we got a report yesterday, so we heard, we heard how it went.
All right, fine.
Yeah.
Anyway, I tried to respond. Does that make me eligible for the?
Well, no, you have to take the survey in order to be eligible for the drawing. The
fine.
interview doesn't count. Sorry.
When is the survey going to come out?
It's going to come out this morning. As
So
soon as I get back
all-
upstairs, I'm going to send an
all employee
all-county email.
email.
You're right,
Okay.
yeah, and then I'm going to send one to department heads also to ask them to encourage.
Been taking lots of surveys. Well, I did a survey for our strategic plan, economic development plan. I don't know if you got a copy of that survey?
I didn't see it.
I did, but I didn't take it because it felt like it was more for businesses and not
More for
me,
businesses
right.
and cities and stuff. I took it and obviously disclosed where I was. Keith, hopefully you got it over in Staten, our economic development strategic planning survey. Good. But I wanted to follow up on a more important topic that you just mentioned about driving while you're talking on your cell phone.
Oh, now wait, I had the
One
device.
swipe, he just did
so-
one swipe.
So
Legal.
last night, and I understand you were in a meeting that went late and you couldn't make it, but I went to the traffic court last night.
I saw your pictures
Oh,
on
are they
Facebook.
showing up already with these?
And so
Tickets?
we did a 5-year service award presentation. There was pizza. There was plenty of pizza
I
left.
thought about it.
Yeah, I had a couple slices of pizza, which is not on my normal routine, and took pictures with the staff and the crew, and they really appreciated. And then I sat in the courtroom. She starts it at 5:30 and she's done by 6 or whatever. Just does those arraignments a little over 6. But one of the things that Jan did was she educated everybody on the new cell phone law. She explained it to everybody who was in the courtroom before she got going. And that was really good how she handled that. And
So now you know you were violating it coming in, texting me?
texting
So do you-
you. When
do you
did
have
I
to
when
turn
did I text you?
yourself in or anything?
No. I can actually. You can push it, and so if you push your phone, and Siri comes up like that, and I say, text Sam Brantano.
What do you want to say?
Say something nice, but I'd like you
So-
watching the road, you know what
so-
I'm telling you?
Say Sam has a dinosaur
I think-
cell phone.
It says search on the road, so yeah, send. So you're going to get that text message,
Sorry,
and
Kevin, I don't know what you mean.
See?
my point being is I have only touched the phone once. It's in Iraq. You're still legal.
All right.
You can do that, okay? Send
Sorry,
it.
Kevin, I don't know what you mean.
Yeah.
You can
that-
send the message, cancel it, or change it.
Send
Or you
it.
can ask me to read it back.
Send it. You're going to get that
I'll
weird
send your
message.
message.
So you can do that while you're in your car. You're goofing me up here.
Okay.
But what I wanted to, my point getting to was you were driving in the snow, you were on your phone, and I know you had your hands-free device.
Yeah, I do.
You were all legal.
Yes.
But sitting in that courtroom and listening to the pleas, the charges that people were going through, it's a good awareness. A 30 and a 20. It's real easy to do 30 in a 20-mile-an-hour zone, right?
Yes, you've seen that.
I've seen
Yeah.
it.
Or
it just,
40 in a
it
30
just
miles.
made me aware of, sitting in the courtroom for a half hour and listening to different things. One guy, 100 miles an hour up 22.
Yeah,
And
that's
he had,
not
I
unusual.
see them most.
He'd been driving for 5 years. She said to him,
I
"How long have
always
you
do
been
this.
driving?" And he says, "All my life." And she goes, "When did you get your license?" And he said, "When I was 16." She says, "How old are you today?" She has all the information in front of her. 21. So you've been driving for 5 years, and you have all these tickets, and
Oh,
she
yes.
suspended his license right there.
Did
Took
I
his
get his
license.
attention?
Yeah, for 90 days. But those are the ones that, those people are really obviously abusive, but doing 30 and a 20 is really easy. It just made me, as I was going home, think about, okay, what's the speed limit here? A lot
Where,
is
where
going-
was the person that did 30 and 20?
We had a side discussion in the break room about the parking tickets up the little North Fork. So they saw a lot of those this year. A lot of, I said, well, what are you hearing as excuse? I didn't see the signs, I didn't know. And she said, well, you didn't see all the signs driving up, you didn't see the signs when you got into the parking lot. And we did a tour with the sheriff, with the deputy up there, and Brian, and who's our parks?
Russ Dilley.
Yeah.
Russ. We did a tour, the four of us, and recommended a few more signs and placements and things like that. But if you're missing all those signs driving up there, you're not
Talking on your cell phone.
You're not
Right.
watching the road.
Texting on your cell
Yeah.
phone.
So it was a good night to be out and see them. And the night before, I went on a drive. Speaking of, been doing a lot of driving with Representative Vic Gilliam, and it was great to spend some time with him. And he wanted frozen yogurt when we got to Newburgh, so I found frozen yogurt and had a good time.
Just, I shouldn't tell the story, but I like it when Siri's talking on your phone. It reminds me of my embarrassing time I went to Mass and Staten, and I thought I better check my cell phone to make sure it didn't ring. You know, don't you hate that? And it was fine. I put it back in my pocket, and then you hear real loud, "Please say a command." I'm going, "Shut up!" Are you
During
kidding me?
church?
Yeah, please say, and it wouldn't quit. Please say a command.
I didn't know
Oh.
your phone talked to you. I thought it was just one of those things that has big numbers that you push. And you have to push it like 3 times to
All
get
right,
12
I've had enough. Anything serious
That's why you
this
didn't
morning?
look at me when hands and words are not for hurting.
No,
We
I
did
read
the pledge.
about that. You're intimidating. Okay, anything else?
Intimidating.
And let's call this meeting adjourned.